Beyond the MD. This has been put together by the Malone Career Center and the Health Sciences Department. They've done an incredible job bringing together a wide range of speakers from different health careers that you may or may not have thought about already. And so that's our goal today, is to help give you some exposure to different health careers, to learn about day in the life of practitioners in these fields. I've met with many of you already, but for those of you who don't know me, I'm TJ Banisaukas. I'm the Health Careers Advisor and Director of the Office of Pre-Professional Advising. So if you're interested in health careers, which we're making that assumption since you're here tonight, and you haven't seen us in our office, please come see us sometime soon. Many of you may have already been working with Miss Korea Allen as well on there. So our office is there to help you explore different health careers, to help you plan for health professional school, timelines, activities, those types of things. So for those of you I have seen, welcome. And for those I haven't seen, also welcome. And I hope to see you sometime soon. I'm going to just call on our panelists so far to give a brief introduction of themselves. Bianca, we'll start with you.
Okay, hello everybody. My name is Bianca Forte, and I graduated from Furman in 2016. I am currently a women's health nurse practitioner with Prisma. I work in the field of obstetrics and gynecology. I do both pediatric and adolescent gynecology and obstetrical care for adults. And so I'm really excited to be a part of this, because when I was at Furman, I knew I wanted to go into the medical field, but I didn't really know in what capacity. And so I'm really happy that you all have this opportunity to learn more and kind of see what you are interested in and kind of the paths to take and classes to take to help you reach those goals.
Excellent. Thank you. Fahad, you're up next.
How's it going, everybody? My name is Fahad Hasan. I'm a recent graduate from Furman from their Masters of Community Engaged Medicine program. Just graduated this past May, and I am a first-year podiatric medical student at New York College of Podiatric Medicine in New York City. And I'm pretty excited to be here because I was pre-med and I applied to medical school and DO school, and this kind of fell into my lap and opened my eyes to something that I wasn't expecting. So I feel like this panel should be something that's going to be helpful to you guys that, I wish somebody would have told me sooner.
Excellent. Thank you. Gene, I've seen you join us. So basically just an intro on your background.
Sorry, I'm having technical issues this evening. I'm sorry, I'm running a little bit late. I'm sorry, tell me again.
Oh, just an introduction of who you are and what you do.
Oh, okay. So I'm Jean Blake, and I finished at Furman in 2002. And I've been practicing my training. I worked as a registered nurse for a few years, and then got my master's as a nurse midwife. So like all my entire career and background has been in women's health. The first portion of it was in OB. So I worked as labor and delivery as a registered nurse, and then as a nurse midwife in a hospital setting in a conventional GYN practice. And then about 7 years ago, I transitioned out of the role of in-hospital and clinical care to just clinic and doing just GYN, and that over the last 7 years has transitioned into a more integrative functional medicine role with all women's health. So it's been a very cool transition, and definitely not where I thought I was going to be, but definitely love the opportunity to do what I'm doing now.
Excellent. Thank you. And Virginia. You may be muted.
Yeah. Okay. Sorry. I'm at my son's football game. I graduated Furman in 2003, and kind of like one of the previous panelists mentioning, I'm a physician assistant or PA, and back then, or when I was at undergrad at Furman, I had no clue what a PA was, never heard of one. Of course, I'd heard of nurse practitioner, but it wasn't until, kind of after I graduated and, again, like when the previous panelists had an interest in medicine, that was kind of working in Charleston, and there was a PA at the family practice office, like, oh, that's pretty cool. And just probably a little bit different from maybe some of the other panelists. I was a business major as my undergrad at Furman, but took a lot of the health or kind of health science pre-med type requisites, and I've been a PA now for 14 years and started out like that, which is one of the things that I have enjoyed about it. I've done urgent care, worked in urology for 5 years, and have been in family medicine for the last like 6.5 years. So it's allowed me a lot of flexibility, especially with family and kind of just balancing those things. I do work full time, but it's in more of an outpatient, I guess, type setting than, like Jean was mentioning earlier, a hospital clinic setting. So it's more your, daytime hours without weekends.
Excellent. Thank you. So our format for today, I have a list of a few questions that I'm going to ask all of the panelists, and then we'll certainly have some time for additional student questions, possibly some breakout rooms if we decide to go that route. So I'm going to try to randomize it a little bit here, except I'm not. I'm going to start back again with you, Bianca, and say start with briefly explain what you do now and what a day in the life looks like for you.
Okay. So again, I work with pediatric and adolescent gynecology in a outpatient setting. And so essentially I am caring for most often non-acute patients. However, once in a while we get those coming through the door. So I have had EMS at the office before. But these are children who are as young as 2 years old, girls, and all the way until age 24. And we just treat primary care concerns related to gynecology. So that's like your sexual education, reproductive health, any concerns with anatomical abnormalities, regarding gynecological care. And then just as we are in a pandemic, all I think specialties departments are kind of, as we always should, treat the patient comprehensively. But I think we're even seeing that more at work now because we sometimes call it gynecology in the office because we have so many mental health concerns that young girls are facing as a large majority, especially throughout the pandemic and kids going in and out of being in school, virtual school, and all those challenges that those also come with. And so we really not only look at the gynecology side of things, but we essentially look at the whole patient to help them as they're going through these changes in life and transitions as they go from a young child to an adolescent. And then on Friday afternoons, I work with obstetrics with the OBGYN Center, and that's across from Greenville Memorial Hospital. And that is a population largely, it's federally funded, and so there's a lot of Medicaid patients there. And so I kind of see it as my local mission. Being able to care for patients that may have low socioeconomic status, lack of education, lack of resources, non-English speaking as their primary language, and so kind of pulling in comprehensive care into their normal prenatal care is one of those things that I do on Friday afternoons. And so that kind of helps me not only keep up my skills and my knowledge with gynecology, but also with obstetrics.
Thank you. And the Jean.
So I I work in a private practice, which there's not too many of those around, at least in Charleston. And it's a 4-person practice. There's 2 physicians, and then myself and a PA. And it started as a really small gynecology practice. And it's grown tremendously in the 7 years that I've been here, because we offer, it's full service gynecology. And so I do all of that. But it's transitioned over the last 6 years, 7 years that I've been there into a more functional, integrative based practice, where, so like all of my, every single visit that I have starts with lifestyle based medicine. So we do lifestyle first. And it's a way of practicing medicine that I love, because it always, like, it's not a like, oh, you got this problem, we're going to give you this pill to fix it. It really is a way of practicing medicine that empowers the patient to really take control of their health and of their goals related to their health. So every visit involves nutrition, sleep, movement, how you're managing your stress, what your relationships look like. And that's the primary focus. Now, I use conventional medicine. I use pharmaceuticals. We use a lot of supplemental support. But foundationally, every visit primarily focuses on lifestyle, which is kind of cool because we're using my health and exercise science background, which when I graduated from Furman, my parents were convinced was going to be irrelevant for me. So.
Yep. Excellent. Thank you. Fahad, your day is a little different, but give them an idea of what it is to be a health professional student.
Yeah. So again, I am a first year podiatric medical student here in New York. I know a lot of people think, like, as soon as they hear podiatry, they're like, "Oh, you must like feet, huh?" It's a lot more than that. It goes into a lot of sports medicine, orthopedics, podiatrics. We do wound care, diabetic infections, ulcers, surgery. There's a lot that goes into it, which I'm sure we'll go into it later with one of the other questions about kind of why I chose this route. But podiatry school resembles medical and DO school. It's a 4-year program, 2 years of classes and 2 years of rotations. And then you take 3 different boards and you have to complete a 3-year residency, which trains you as a podiatrist as well as a foot and ankle surgeon at the same time. So you can choose which way you want to go, and it gives you a lot of flexibility to, decide, hey, surgery is for me. I want to go this route, focus that way. Or, I just want to go work in the office or like a private practice, open my own clinic and go that route. So it gives you a lot of flexibility and a lot of exposure to different opportunities there. A day in my life is pretty hectic. I'm taking 6 classes in 2 labs, 5 classes in 2 labs. I have cell biohistology with the lab, physiology 1 with the lab, genetics, biochemistry, and bacteriology currently. So, I'm in class 8 to 9 hours every single day during the week, and it's pretty intense because, like, sounds like a full-time job, like when you study for all these classes. So normally what I do, my normal, day-to-day schedule is I try to wake up as early as I can and kind of skim through all the lectures for that day, get a head start on like what we're going to learning, take my time, take my dog out for a walk, get everything situated, and kind of get the day started early and try to get ahead, because I saw quickly that if you fall behind, the material start piling up, there's no way of catching back up. And if you do, you feel like you're always like one step behind trying to pile on the material. But yeah, then I go to class, pay attention in lecture, take as good notes as possible. So that way, at that point, expose myself to the material at least twice by now, go through my whole day, and then we do get a lunch break thing for an hour. We have a cafeteria on campus, which is nice. Usually eat there or just walk back home a couple blocks away from the school. And then finish out the day, come back, take a break, and then study again for a couple hours, the material that we went over that day. And then if I have time or I finish early, start on the next day and try to go to bed early most nights if I can, and then repeat that again the next day, basically.
Thank you. And I'm going to use my opportunity here to provide some additional commentary on that. As faculty members here, we hope that all of you at the undergrad level are taking that same approach of doing some pre-preparation for each class, and so as not to get behind. And I know all of you do exactly that, and that you're all getting good amounts of sleep at night. So thank you, Fahad. That's great for them to hear. That is how to approach the grad school level. And then Virginia.
Yes. I was just going to start out by saying that, I work for a fairly busy family practice that is, like, Jean was saying, it is hospital owned by one of the hospitals in Columbia, Lexington Medical Center. And they have multiple family practice offices. Like any job, I love the people I work with. There are four physicians and myself as a PA and another nurse practitioner. So our office, we have CT, we have X-ray, we have lab, we have someone, and I did just want to mention this, just as other kind of healthcare professions, like we have like sonographers that come to our office from the hospital, a couple times a week, and so there are vascular sonographers that do like echocardiograms, look at the different chambers in the heart, and then they're just, I guess, regular quote unquote sonographers who do ultrasounds of thyroids, abdomens, kidneys. So those are also, I feel like, things you don't always realize when you're not working in the medical field, but those are sort of our kind of ancillary services. I work fairly independently. I have a supervising physician, who's in the office, really the majority of the time, but I could go to any one of the doctors I work with if I had any problems or, concerns. And sometimes it's really just if I happen to be seeing, one of their patients, but I do have, a fair amount of my own patients. And with COVID, we've kind of restructured our schedule to where we only see well visits, kind of in the morning, don't start seeing sick visits until about mid-morning. And we've also integrated telehealth visits since the pandemic, which has been, really nice. I feel like, for the patients to have that flexibility, mostly anxiety follow-ups and things like that are very easy to be done over televisits, and patients are sometimes a little bit more comfortable in their own environments when you're, kind of talking to them. But family medicine in general is birth to 99. So we it's kind of a joke. We sort of see and do everything. A lot of not OB, but especially I am one of two females in the office, and so end up doing a lot of gynecology. And it's, we are the patient's, quote unquote medical home. So, you might refer them somewhere, but, they've got, been dealing with belly pain or, some stomach issues, and they go see the gastroenterologist, they get scoped, and then they come back to you because everything was fine and they're still having the issues. So that's where I think kind of like what Jean was talking about, you kind of get into more of that, kind of integrative lifestyle approach with the patient. But family medicine too is, you see a lot of parents and children, you see a lot of, people who's maybe older parents or patients in the practice, husbands and wives. So that part is kind of neat. And then, you do obviously develop a relationship with a lot of these patients. And again, similar to, a lot of people use their gynecologist as their primary care. But you have a relationship, and sometimes patients, they want to do what you ask because they want to please you. I had a lady today that has done really well with her diabetes, and she was telling my student, she was like, well, she's like, Virginia stuck with me, and she, she was going to put me on insulin, and then she had like a little mini stroke this summer, and I think it was maybe a wake up call. And anyway, now she's doing what she's supposed to. But I usually see 20, 25 patients a day, just kind of depending on, but we do physicals, pretty much any and everything. So.
And then Virginia, I'm going to go off script a little bit. It's amazing that I've been on script as long as I have at this point. But you mentioned televisits. You may have mentioned this when you're talking about it. Do you foresee your practice continuing to use televisits at the same level post COVID? Is it something that increased during COVID?
Yes, it's something that I think we're sort of set up for as far as our electronic medical record system, but had not really utilized. And I don't, the only thing, here's the dictator of everything, is if insurance companies were to stop paying for televisits, because they kind of like granted like some, I think that, well, again, my understanding is that there was some sort of extension or, leeway, or I don't know, but I don't really see them taking it away, because it's just way too convenient for the patients. Now, I tell people, I'm like, if you've got a UTI or back pain, or I need to check your blood pressure, those are not things. It has also been helpful, I should mention too, for those who we were kind of checking up on with COVID, to kind of follow them closely. And now everybody has a oxygen monitor for their fingertip, just like we have thermometers, because they're at every drugstore. And so, that was one of the ways we would sort of have the patient sort of self-monitor through, telehealth visits, when they were, because you didn't want to bring a COVID patient in the office. But yeah, I don't see it going backwards.
Excellent. Thank you.
Yeah.
And then, so our next question round will be focused on what went into your choice for finding this healthcare passion. So the question is, and we'll start with Fahad for this one. How did you decide to pursue, in your case, podiatry as a career, and what were some important factors in your decision?
Yeah, so this, like I kind of mentioned earlier, it kind of like fell into my lap and kind of opened my eyes to something that I knew about, but I had to kind of do a lot of research into to realize that, this was another path that I could take to becoming a doctor that I was oblivious to completely. But last year I was in the Master's of Community Engaged Medicine program at Furman, and I was, on track to. I was applying for medical school, DO schools, wanted to be a doctor. And while I was doing my applications online, I was getting those random emails like, oh, you might be interested in podiatry. You might be interested in podiatry here. So I was like, you know what, let me look into this a little bit more and see like what it's about. And so after I take my MCAT the first time, felt defeated over winter break, and I was studying again for it. I did a whole bunch of research looking into like everything podiatry had to offer, basically. Look, I went to multiple webinars from different schools. Fun fact, there's only 9 podiatry schools in the United States, which is pretty crazy. But I did all my research. I went to a couple webinars. I talked to advisors. I had friends from high school that actually went that route, went to undergrad and then went to podiatry school right afterwards, who are either practicing TPMs now or finishing up their residencies currently. I got their advice, their opinions, all of them gave me great feedback. So, I kind of did all this research into it, and, got multiple opinions. And my career path that I wanted to take was to, go into either sports medicine, orthopedic surgery, and cardiology was up there too, vascular surgery. And when I did more research into podiatry, I realized that's everything they focus on. They do foot and ankle sprains, they do broken foots, charcot foot surgeries, ankle replacements, complete reconstructive surgeries. As far as the surgery goes, it's all orthopedic surgeries. Didn't realize how many blood vessels there were in the foot, so the vascularity of that is massive. So that kind of tied into my interest. And then there's a lot of sports injuries that are related to foot and ankle. A lot of football players always breaking their ankles, they're tearing their Achilles. So it kind of tied into everything that I actually wanted to do, and it gave me the flexibility to learn all of it at the same time and not necessarily go through the whole med school process and learn all these specialties, rotate through all the specialties, and then try to get matched into that specialty that I wanted to, because this is going to let me go straight into those specific areas right off the bat. And I don't have to assume or guess and hope I can get matched later on in those areas. I'm going to learn it regardless, and I know what the end goal is. So I think that played the biggest role in my decision to pursue the podiatric medical school route, because it allowed me to tackle all the interests that I like, learn all of it, and guarantee my place to do either sports medicine or orthopedic surgery. I can pick and choose where I want to go without worrying about getting matched into it. It all encompasses the same fields, which I think was like the biggest side factor for me and why I chose to go this route instead of pursuing regular medical or DO school.
Excellent. Thank you. And Gene, you're up.
What's the question?
I forgot it as well. I was hoping you remembered. So how did you decide to pursue your field as a career, and what were some important factors in your decision?
So I really wish I had a better story, because we actually had dinner with my parents last night, and we were talking about this because I was telling them I was doing this, and I was health and exercise science major at Furman. And I remember super clearly, my parents remember this too, a conversation we had. I was telling my dad as I was getting ready to graduate that I knew there was a job, but I couldn't tell him the name of it. But I knew that there was going to be a job that I could do. So that, of course, didn't go over all that well. And I really fell into nursing because I couldn't think of anything else. Which isn't the most exciting path into medicine at all. But it's I feel like it's come full circle, because my first in nursing, I really it was okay. And then I knew leaving Furman, I was a tennis player at Furman. And so I knew what love for something and passion for something, because my experience at Furman as a tennis player through the tennis program was just amazing. I mean, it was an amazing team, amazing coach, and I knew I loved that piece of it. So I wanted to take that passion into something else. But at 22, I had no idea what that was gonna look like. So I really feel like it through a series of events, I just so thankfully ended up in this career, because the beginning, I mean, literally my first day in nursing school, I wanted to throw up. I hated it. And I kept going because I couldn't come up with any other viable option. And kept going through it, went into labor and delivery, loved that. And truthfully, I knew midwifery was kind of the next appropriate step, and I liked that. But I think this is an interesting point to make as a 20-something mid-level provider working in the practice that I worked in initially, which is a hospital-owned practice where I was doing OB and GYN. I was the youngest of a whole bunch of older female doctors. And I felt that it was a very condescending, I didn't feel empowered at all or even knowledgeable in my field. When we were called mid-level providers, that's exactly what I felt like. And I had an experience with a physician at one point. She was like, "Oh, little Jean, it would have been really nice had you gone to medical school." I was probably 30 at the time. So, that kind of stuck with me and was really like, I mean, I knew I had the ability and the knowledge and the skill set to work at a higher level. And so, in the hospital, I did that. But again, midwifery care in Charleston in the role that I was in, was definitely a mid-level job. And so this opportunity 7 years ago came along, and believe it or not, I was hired by he's a older male physician who's been in practice in Charleston for like 40 years now. And I wouldn't have thought that would have given me the opportunity to feel empowered in my work. And it has. And through that, I moved, like I said, out of a hospital setting into a private practice. And my learning curve over the last 7 years has been remarkable. And so that passion that I was looking for 20 years ago, like I found it. And it is a super life-giving way to take care of patients. And I feel really knowledgeable. I feel really strong in the position that I'm in, so much so that, the physician that I work for now, he'll come to me with things. So there's no more like, oh, I'm sorry, you're mid-level, you don't know what you're talking about. So it is, I know that I know I'm very confident in my role now. And granted, it's taken 20 years, but it's where I know I'm supposed to be, and I know that I'll stay because, like I said, I feel empowered in my role, and I have the ability to empower the patients that I take care of to really take control of their bodies and their health, which is a super cool spot to be in.
Excellent. Thank you. And then let's see, let's go to Virginia next. Oh, you may be muted. Oh, should not be driving.
Yeah. Again, like I said earlier, I wasn't really even aware of what a physician assistant was when I was at Furman. And then I've got several family members that are doctors, and I kind of really remember distinctively too. One of my uncles who's a specialist kind of saying like, you really don't want to go into you really don't want to be a doctor, it just, I feel like when I looked into it, being a physician assistant gave me a lot of the benefits of doing what I wanted to do with medicine without like a lot of the negative things. Like I've had a lot of flexibility in the type of medical practice that I've worked in, a lot of flexibility as far as like how much I want to work or not work, and hospital versus private practice, and then not a lot of the medical debt that a traditional medical student would incur. So.
Excellent. Thank you. And then Bianca.
Right. So I kind of decided to be a nurse practitioner through not really trial and error, but it was kind of like a journey, if you will. And so I went to Furman, health science major, and I loved a lot of my classes within health science, especially like those where I could think critically. So like my public health, my global public health, things like that really allowed me to use some of those like hard thinking skills to overcome like certain problems or situations that many at-risk populations experience. And so I knew I wanted to somehow be in a career that would allow me to really utilize those capabilities. And so I would recommend this to all students. Furman is wonderful for helping you get connected within the community, or they have wonderful internship experiences. They have a great alumni connection. And so I would really recommend that even if you don't know exactly what it is that you want to do within the medical field, there's so many avenues where you could get exposure to it. And so that's exactly what I did. I internshiped locally at the Greenville Free Medical Clinic, and there I was able to see the different roles that different health providers carried out. And so, you know, you have all the way from billing, you have all the way to the management of the health clinic, you have providers, you have mid-levels or nurse practitioners, PAs, and then you also have nurses. And then they had specialty doctors rotating in to help treat those patients who needed that specialty care. So that was really cool. And then you kind of got, well, I kind of got to see that whole public health come into work and helping meet those patients' needs that were at risk. And then additionally, I studied abroad. Another wonderful plug for Furman. And I did a medical internship in Edinburgh and worked with multiple sclerosis patients and hyperbaric oxygen therapy. And so that was just another cool realm of medical care, or the medical side of things, to see. And so throughout my time at Furman, I just tried to immerse myself in more opportunities to better understand what it is that I wanted to do. So then I graduated from Furman, and I was like, well, I think I want to go into nursing, because that's kind of what really stuck out to me at that point in my life. And then I graduated in May from Furman, started in August with Anderson University, which is right down the street, and they had an accelerated Bachelor of Science in Nursing program. And so many schools have that. If nursing is something that you're interested in, don't give up, and don't think that the health science or biology or whatever track you're on isn't going to be good, because it is, because you could carry that with you if you do decide to go into a second program like I did. And so that was a 15-month program, very intense. Just like Jean, I probably second guessed myself a lot on whether or not I wanted to do nursing school, but you know, you kind of just push through it, and you really build a good development and foundation with your cohort, and you have study groups, and same thing as Furman with office hours, and really seeking assistance with your professors and support and care that you may need through that time. Then graduated there with my accelerated Bachelor of Science in Nursing degree, and just kind of reached out everywhere to try to get exposure. And I wanted something that I then could also critically think again, something that was more so fast paced, and something that would give me more exposure to better understand what it is I wanted to continue on, because I knew this wasn't where I wanted to end. And so I went to work for Duke Emergency Medicine in Durham, North Carolina. And that was an eye-opening experience. But I have to tell you, that helped shape me in so many ways. It helped me grow in so many ways, because I was just able to learn so many different things. And often many people hear that the ER is a Band-Aid for conditions. And unfortunately, sometimes it does work that way, especially when you're working there through a pandemic. But we had an amazing team that really cared about the patient and tried their best to make sure that they had the adequate resources. We utilized social work and case management, mental health resources, all of those things to try to give patients the best emergency department experience. Now, while I was going through my emergency experience, I realized that I really wanted to further my career, and I wanted to do more. Like, I wanted to dive deeper into medicine. I didn't want to just carry out orders or assess my patient, but I wanted to be more so behind the scenes of helping make those decisions of what comes next. And so this kind of goes back with those like care plans, care maps, and like the one when we get up on the whiteboard and draw all these things out about where it started. And so I love that kind of stuff. And so I applied to graduate school, and I kind of knew that through exposure in the emergency department, I had a great passion for women's health and OB care. Many patients came in, and that was the first time they found out that they were pregnant. They were far, far along, and there was a lot of like sexually transmitted diseases, just a true lack of education in terms of sexual and reproductive care. Additionally, I did some personal research with a colleague of mine who I now work with, and she was my former instructor at Anderson, Casey Hopkins. I don't know if some of you know Chris Hopkins, who's at Furman in the Health Science Department. And so I did research with her with prenatal outcomes on women who are receiving federal funding or government assistance, and how they perceived their prenatal care and what their birth outcomes were. So that really opened my eyes to my passion for women's health as well. And then lastly, through mission trips to Honduras and Guatemala, that passion was just even further illustrated to me. And so I pursued a route with women's health. And there are so many tracks in terms of a mid-level provider or just the nurse practitioner realm of things. And so they have critical care, they have acute care, you could do pediatrics, you could do family nurse practitioner, and there's so many avenues that you could take, and you could subspecialize. And so it doesn't end there, even if you have more desires to learn more and do more. And so I graduated from Emory in December of this past year, and I started my first nurse practitioner job in March. Where I am now with Prisma Health. And so I could tell you that there is definitely a learning curve. And I tell my supervising physicians, I am not afraid to tell you what I don't know. I want to take it all in. I want to learn the most that I can. And for instance, just to tell you guys about how learning never ends, I was just in the OR 2 weeks ago, and I got to see a diagnostic laparoscopy being performed by one of my supervising physicians. And then even a bilateral tubal ligation. And so, although I wouldn't be performing those procedures, it's just cool, and it contributes to my learning because I'm better able to see within the pelvic region, the pelvic cavity, and so that I can better help my patients. I don't know if any of y'all are visual learners, but that's always been me. And so when I saw inside, I was like, wow, this is amazing. And my colleagues joked with me, they said, so much so that you'd want to go to med school. And I said, probably not. But so that's kind of how I decided and how I kind of landed where I am. Now I'm also doing some research with Casey Hopkins. She works with me in the office, but then she also is she has her doctorate in women's health, and she works for Clemson and does a lot of research and grant funding and things like that. And so she's kind of asked me if I would be willing to be a part of that with her. And I've really enjoyed that realm of things too, because I think it's just important to stay up to date on information. We most commonly call that evidence-based practice, and it's always changing. And we've learned that even with like telehealth and adjusting to that side of things. And so it's just kind of that medicine can be a little bit of a roller coaster at times, and sometimes you may not know where you're going to end up, but I just encourage you to follow the ride and take all the opportunities you can to make yourself have more exposure to it.
Excellent. Thank you. And then okay, let's see. So we probably, before our 8 o'clock break, or not break, but for questions, I'm going to jump down the list here. Let's go to, well, actually, I think the next question is the best one. Let's go with what characteristics, skills, and abilities have you found to be essential in order to be effective in your position? And we'll start with you this time, Jean.
Wait, sorry, ask the question again.
Sure. What characteristics, skills, and abilities have you found to be essential in order to be effective in your position?
I think something Bianca just alluded to, which is being willing to be a lifelong learner. I think that is, and not you're not reaching the end anywhere, and that's been just probably in the last 3 years that I've really experienced that. But I think I feel like I keep coming back to being a woman in this field, because I have 3 kids. I'm married. I have 3 kids. I work part-time. So there was a season when my focus was just that, primarily on my family, going through 3 pregnancies, 3 kids. and so, there's not a whole lot of time and space for professional growth. But as my kids have gotten older, the focus has shifted, and I thankfully, as a nurse practitioner, I've been able to pour into my career when I want to, and when I have the time and space to do that. And then when I didn't, that was fine too. But now I'm at a season where, my kids are older, and I'm definitely looking to grow in my profession. And so I think just being okay, like you said, Bianca, with not knowing stuff, but being willing to learn it, and being open to continuing learning. And I think in medicine too, like, God, I keep going back to, but I think it being such a male dominated industry for so long that you go in, you feel like you've got to know all the things, and that's just, that's not the case. And I have seen the pendulum swing over the course of probably the last 10 years that I've been doing this, and especially with COVID, because I feel like that's just been like a big event that's been like, okay, we really don't know as much as we thought we did, but again, that's why I like the functional integrative medicine piece that empowers patients to take control of their health. And I'm certainly seeing that in the population of patients that I take care of. They're coming in knowing what they want, knowing what they need, which, I find probably in conventional medicine, that can be double-edged sword, because you've got patients coming in asking for the medications that were on the commercials that they saw or whatever. But you definitely, being willing to say you don't know, and being willing to learn, would be my answer to your question. That's a long-winded answer.
Thank you. That's a great one. Okay, let's go to Fahad.
Yeah, I wrote some stuff down because I was like, there's a lot of things actually that I've been implementing to, stay on top of things and, make sure that I'm doing well and successful in this first semester. I think one of the biggest things is time management for me, because like I mentioned earlier, we have class 8 to 9 hours almost every single day. So, you have to find those times within that to study, because, if you're sitting in class and you are trying to learn all that material, you're using pretty much the entire day to learn that material for school, but then you have to study all the stuff that you learned, and tests pile up. Like, for example, I have 2 exams every week. I have an exam on Monday, I have an exam on Friday. And I had an exam today, I have one this Friday. 2 different exams, 2 different classes, and studying for that, it requires a lot of time management, which also kind of goes into some of my other things, like getting a planner helps. I keep both a written and a digital copy of my calendar, because sometimes you can't trust the internet, or sometimes my events don't save and I can't remember. Sometimes things overlap and I'll forget. So writing it down, having a planner and staying on top of it kind of helps. Like earlier when we started this meeting, I was actually in a TA review session for my exam on Friday, because we have to have at least 60% of the class at the TA review sessions in order for them to share the answers with us. So kind of forces participation and gets people there. So I logged in just to add to the numbers so we can get those answers emailed to us later. And then sticking to a routine, I think has been pretty helpful. It seems pretty repetitive, but thankfully, so many classes, the material's changing, the stuff you're learning is changing. But my daily routine is pretty much the same. Wake up, get ready, walk my dog, study a little bit, go to class, lunch, class, relax a little bit in the evening, and then study again before bed. But sticking to that consistent routine, I think, helps. Making sure to sleep. I know a lot of my friends in class, they pull sleeping, eating, and making time for even a little bit of exercise, even if it's 20 minutes of walking around, getting some fresh air, makes a big difference. I know a lot of people in my class, they pull all-nighters. They're staying up super late, sleeping 2 hours before an exam, walking in looking like a zombie. Meanwhile, I just got 7 hours of rest the night before, and I woke up feeling refreshed for the exam. And I feel like I found that it's been helping me a lot more to be like refreshed and ready for the exam. I'm not scrambling to remember answers. Like, it makes a big difference. It is hard to do, especially the night before an exam. You're like, oh, did I study this? Did I study that? Did I remember to look at the study guide for this? And, it's hard, but, time management, sticking to a routine, staying on top of it, planner, is pretty helpful. And I think also figuring out when you're the most productive. If you're a night owl versus a morning person, I think that also helps. Because if you try to force yourself to study in the morning, you're not a morning person, you're not going to want to study. So utilize what works best for you. If you're a night owl, stay up late, that's fine. Study if that's the best times for you. If you learn best at night, you study best in the morning, study in the morning. But not forcing it, I think, also helps a lot. And then being flexible, because, in undergrad and grad school, when I was doing my Master's of Public Health at Florida State, compared to my Master's at Furman, the Community Engaged Medicine program, the way I studied in one grad program was completely different from how I studied in the other program. And even now, all those study skills are like meshing together and colliding, and I have to be very flexible with how I'm studying for each class because it does vary. And being able to recognize, like, this class is straight memorization. I can do some flashcards. This one is more concept based, so I need to make like a roadmap of what's going on and make sure I can understand the flow of things. Using colors helps me a lot, especially with like different roadmaps and pathways. Learning gluconeogenesis, definitely how to use a lot of colors for that. But staying flexible, because you have to constantly adjust the way that you're studying. And as classes change and vary, you're going to change how you study every single time, because you can't study the same way for every class. They're all going to switch. So staying flexible, not getting overwhelmed with it, just learning how to study for those classes will take some time. It took, I'm 9 exams in and I'm still fine-tuning the way I'm studying for each class. So staying flexible is, I think, pretty important. It's helped me.
Excellent. Thank you. And then Virginia.
Okay. I'll kind of piggyback a little bit on what the two other females said. I think one of the biggest things is, being confident in yourself, but then also, kind of knowing, when you've got that kind of like thought in the back of your head, like, well, should I do this? Should I do that? Or should I ask about this? And, to do it. But I think as far as, being confident, in yourself, a lot of times that goes along with, especially in, primary care settings such as, OBGYN and family practice. I mean, sometimes patients are literally just looking for some reassurance about something. I call it hand holding. And I say I'm a really good hand holder sometimes. But they're, you have to, portray that, you're confident. And it comes, I feel like, with practice and experience and, and also, confidence to say no, when, patients come in and demand medication that's not appropriate. Have lots of examples of that, but, just, and the confidence to say, well, if they want to go find that drug from somebody else, then they can. And when I first was practicing, a lot of it was, paying medication prescriptions in an urgent care setting, before things were so tightly controlled, and, kind of getting beat up for that gives you thick skin. Listening to your patients, a lot of time, especially in urgent care, we learned a lot about, bounce back patients that kind of keep coming back with the same, sort of complaints or problem, and to repeat some of those tests and to add more tests, just to kind of keep looking if a patient has a concern or a problem, and that also helps your patients to have confidence in you, when they're all like, oh, I'm sorry, I've been here 3 times this month, or I'm sorry, I'm like, no, that's fine, I'd rather you come than not come. So I think, yeah. So, those would be the main skill sets I would.
Excellent. Thank you.
Yeah.
And then Bianca, back to you.
Alrighty. So for me, I think I've really learned that one of the best characteristics or skills is just being present while you're there with the patient. Kind of based on what other people have already said. Sometimes it is just that reassurance. Sometimes it's, especially with adolescents, they don't have an adult or guardian or family member who will really listen to them and their concerns. And so you are their advocate. And so you want to make sure that they know that they are in a safe place, that they are in a confidential place, and that you are there to support them. Additionally, with that, I have been around physicians, mid-level providers before that kind of aren't really present because they have so many other involvements, or they lead different chairs or groups or journal clubs or whatever. And so there's a lot of things going on, not just professionally, but also in their personal lives. And so I think sometimes you have to realize how to balance work and life. And we have to do that through all stages of life. And so I just think that the least that I can do for my patient is make sure that she's heard, and making sure that she knows that I'm all hers during her visit time. Additionally, I think you have to be patient and flexible. I can honestly tell you I am not a very patient person naturally. And so sometimes whenever a patient doesn't show up on time, it may not be their fault. And so it could be, they're an adolescent, they can't drive. It's not their fault they're late to their visit. And so trying to not hold that against them and just picking up whenever they, when they come in and you're able to see them and you just are honest with your patients. I'm so sorry, I'm running behind. I just had to help another patient, but I'm here and thank you so much for waiting for me. And then in medicine, I always had this view that there weren't other things that we needed to, hold on, let me rephrase that. Okay, so although medicine is a business, we are there as medical professionals, medical providers, to not necessarily think about the financial realm of things. Obviously, we have to have money coming in to make a practice or organization function. I get that, but so many times we are led by, let's say, like how many minutes you get with your patient. You only have these many minutes. There's all these barriers and boundaries that you have to meet, and you have to meet all these indicators and standards and all of that, and that's fine. But I just want to encourage you, don't get lost by the business side of things. Like I don't even ever really look at my patient's insurance unless, like, let's for say they're getting an implant or an IUD, and I know those are about $1,200 or $1,400 to get in. And if cost is a problem at that point, then I kind of tell them about other programs and grants where they can get that contraceptive device at free or low cost. You know what I mean? And so there are ways that we can overcome some of these barriers, but I never want anybody to be like limited by how they provide their care due to any type of promotion they're getting or any type of financial gain they may win, or they feel like they can't really treat their patients' needs because of financial barriers, because we see those all the time. And so essentially what I'm trying to say is don't treat your patients like a number, treat them like an individual, because there is a business side of things, and you will somehow get, you'll have exposure to that, but you just kind of have to let it go and let the people who handle the business side of things handle that. And then lastly, I just want to touch on that lifelong learner skill again. You never stop learning. And so there's going to be times when you make mistakes, just like any time in your life. And so obviously we don't want to make a life-altering mistake for a patient. But if you do make a mistake, you just need to be honest about it, and tell the patient, tell their family, tell your coworkers or colleagues, so that way you can have support and learn from that mistake, because we are all human. And so, yeah, I think that's it.
Excellent. Thank you. And I think what we'll do, I know there was a few other questions on there, but let me check in with Rebecca. What would be the best format for now to break out for questions from the group?
I think we're just going to keep everybody together, but give folks from the audience just a chance, if you have a question, to either put it in the chat. If it's for a specific panelist, you can make sure you include that information, or you can raise your hand, and if you want to call on them to unmute, that's fine too. So we'll just kind of open it up to the audience for student questions. And then if there isn't any, we can kind of ask a few more and wrap up.
Okay, I have a hand raised from Isabella.
Hi, my name's Isabella. I'm a senior health sciences major. And I just kind of wanted to ask, this is kind of just a general question, I guess, for anyone, and I know, Bianca, you kind of touched a little bit on like the business side of medicine. So I just kind of wanted to ask, did anyone ever consider pursuing I believe Virginia, you said you were a business major, but I was just curious, did anyone consider pursuing maybe an MBA, especially those of you that kind of might have anticipated that you wanted to go into private practice, or maybe even wanted to like set up your own independent practice? That's just something I was curious about. Thank you.
I can speak to that just a little bit, because probably the difference between Bianca and myself is I look significantly older than she is. So I've been doing this a little bit longer. And I would say that is a real, that not having any business experience has been crippling. That the divide between healthcare practitioners and their knowledge and their focus on patient care, and taking care of the patient, and not having any clue about the business side of it, or how to run a business, has really created, and I don't know what the answers are to fix the situation, but it's an industry controlled by insurance companies that have no stake in the business or the patient's well-being. And I see that a lot more, I think, in private practice, because we are a tiny private practice and not hospital owned. But I think a lot of that, and the parameters that are put on time, the time restraints, the number of patients that you see, that's all dictated by insurance, which again have no stake in the well-being of the patient. So your thought, Isabella, I think on getting on having a business background with a desire to go into medicine is very smart.
Thank you.
I was just going to kind of piggyback on Jean real quick, since she had mentioned me. So I have worked in a private practice setting. When I worked for a urologist, it was a solo physician, not hospital based. So there was no, sort of deep pockets. And one of the things, just as an example, is that one of the antibiotics that we would give a patient intramuscularly before a procedure, the cost of the medication was more than what Medicare would reimburse for. And for someone, you have to obviously, especially, again, hospital has usually the bigger, deeper pockets. But yeah, those are kind of the reasons that there are not as many, privately owned physician practices. My uncle is actually practices in a rural area and has been independent for 40 years. And that's, again, like Jean said, it's rare. I was a business major, but I tell you what, I don't want the headache of trying to manage reimbursement from insurance companies and things like that. There is a lot, like Jean says, it's just, some of the things that you have to deal with insurance companies and, fighting for things for your patients that are, it's so much is not up to you. It's, up to what the patient's insurance wants. The patient's like, oh, well, I think this would be a great drug for my cholesterol. It's got no side effects. I said, oh yeah, I like that drug too. I said, but your insurance probably not going to pay for it, and that's with imaging, But yeah, I mean, I think it just depends on what you want to do with medicine, and if you were looking to, so I'm sorry, the podiatrist on the panel, like somebody like a podiatrist, dentist, people that traditionally own their own practices. I would definitely say, either have a business partner or be knowledgeable, especially when it comes to like what insurance companies pay for or don't pay for. So.
Thank you. April.
Hi, my name is April, and I'm wondering, how do you most effectively deal with imposter syndrome if you encounter it in your career?
I don't mind starting with that. We actually talked about this, and this is an awesome question that you have. Not only do new experienced medical professionals face imposter syndrome, but also like experienced professionals that maybe feel like they don't have they're not up to date on the latest evidence-based practice, or they have kind of been, in a sense, kind of stuck in past ways and past practices and really aren't as familiar with the new ways. And so for me, it is because I feel as though this is my first NP job, and I feel a little bit intimidated at times and worried, what if I don't know enough? What am I going to do if I get in a bad situation or whatever? But the greatest thing about medicine is that you are never alone. And I mean that like very seriously. I am by myself at my office about 3 days a week. And I was really scared about that, especially being a new NP. But I have the phone right next to me. I have so many resources. I can call anybody if I have any questions. There's so many online platforms like Up to Date, Hippocrates, things like that that you can utilize. And sometimes it's just building your confidence level. And so believing in yourself and kind of listening to that gut instinct at times, but also utilizing some of those other resources like Up to Date, Hippocrates, or some of your textbooks to maybe even build that confidence up and saying, oh yeah, I was thinking along the right, guidelines, or looking at this algorithm, I was using the algorithm correctly, and this is the next plan. And so as you travel through your medical journey or your career, you're going to realize that you're going to become more comfortable with things over time. But then just as medicine's changing, you're going to feel it all over again. And so I just think that's that cool thing that reminds us as individuals, as providers, that like, don't get too comfortable because something is going to surprise you or something's going to change. And just because the textbook says this or your colleague said this, there's patients that are outliers. You know what I mean? And so sometimes you do have to think outside of the box, and you're not going to be, you're not confined by an algorithm or, a protocol.
Well, I
Oh, absolutely.
answer on that. So the idea of like feeling like you're not good enough or don't know enough, I kind of feel like that's a little bit of a good thing. That's been definitely a learning experience throughout my whole career. Cause I feel like, you come out of Furman where you're surrounded by not very diverse, basically well-educated, where you feel like you're doing your thing and you're at the top of your game, and being, I feel like, a mid-level provider put me in so many situations over the last 15 years that have been very humbling. And I think ultimately that served me. And I think it ultimately gives you a little bit more perspective and a little bit more compassion for not only your patients and people you're taking care of, but I think it also, for me, it's helpful in other areas of my life as a mom, as a wife. And so to be put in experience in situations where you are humbled because you don't know, and you have patients that are outliers, you have physicians who think you don't know what you're doing. It's, to be able to handle those situations with grace, I think is probably better than always feeling like you're great and good enough and belong.
it's okay if I add to this as well. So from the student side, I know the first like 2 or 3 exams I had, I definitely had imposter syndrome because I didn't do as well as some of my friends or some of the other classmates. And, I'm hearing them, oh, I got 98, I got 96, I got this. So it made me feel like, I studied just as much as they did. Why didn't I get that grade? And I came to realize that the imposter syndrome kind of came from actually being around them before the exam. I would show up to campus early and try to review with my classmates. People are throwing out answers. I know this, I know that. This is what this is, and it kind of got into my head. I was forgetting things. I'm like, I studied it. I do know that, but it was the influence of other people around me that made me feel like an imposter. Even though I knew the material, but it got in my head. So the way I kind of overcame that was I stopped going to campus early. There's no need to. There's no need to listen to other people. Because half the time, they're just as confused on what's going on, or they don't know what they're talking about. They could be acting like they know what they're talking about, but it could be completely wrong information. So it throws you off. So I kind of stopped going to campus early. On exam days, I get up, I take my time. I'll take a shower, eat, make sure I get a light breakfast in me, not too heavy because you don't want to be digesting food during the exam. You want that blood flow going to your brain. But I take my time in the morning and I let myself get adjusted or review. And then I started doing even 5 to 10 minute guided meditation just to control my breathing, get out of my head. I studied, I know I prepared for an exam. At this point, an hour, 2 hours beforehand, I know what I know. Stuff I don't know, I don't know. It's not a big deal. You know how much you prepare for the exam. Just be confident in yourself. And then I show up 5 minutes before the exam starts. I walk in, put myself in my locker, and go straight into the exam. And I have my headphones in, and I listen to calming music, hype music, whatever you want to listen to that makes you feel good and gets you ready to go. Because I think that my imposter syndrome came from the people around me and hearing everybody talking. It just got in my head, and it made me feel like I was inadequate afterwards because my grades were not as high as they were performing. But now I'm thankfully doing significantly better. I'm not letting other people influence me, and I no longer feel like I'm an imposter. And sure, I get questions wrong here and there, but can't get 100 every time.
Excellent. All great advice on there. Oh, and I see one in the chat. Oh no, that's the message from Rebecca explaining to me what we were doing. Sorry about that.
Gotcha.
Yeah. Other questions? So we have one. This is for you, Fahad. What is the process like for applying to podiatry school?
It is exactly the same as you would apply for MD or DO school. They use similar software. Pretty sure it's exactly the same as the DO website portal. The same exact structure, same everything. You have to take the MCAT. So I know it's hard and frustrating to study for that, but it is a requirement to get in, and it's pretty much the same process. Upload all your applications. You have to do a cover letter, personal statement. Each school requires a different amount of letter of recommendations. Some require a letter of recommendation from a podiatrist that you shadowed. So, because sometimes people get into the field or get into the school and realize that they actually don't want to do this, or some of the things freaks them out, or it's too gross, and they realize that it really wasn't for them. So I think some schools use that as a reinforcement, go shadow a podiatrist, and then make sure this is what you want to do. And then you have to submit it, and then there were no secondaries, medical school or DO school. And then you just wait for an interview, you interview, and then usually hear back in a couple of weeks. So it's a very similar process minus the secondary applications.
Excellent. Thank you. And Callum, just to follow up on that a little bit, The step one will definitely be to come see us, and we can keep you up to date on the deadlines for that process. But I also wanted to reinforce something that Fahad said there in terms of in any field, it's so critical to have that opportunity to shadow or to talk with people in the field to learn about that day to day. And that's part of what obviously our goals are tonight on there, to give you that exposure. And then with regards to fields that require some shadowing to get a letter as part of the application, I have found that the Podiatrists National Association is so excited to recruit people into the podiatry field that they maintain these network lists of people that are on board to talk with you, to offer some shadowing opportunities. And so that could lead to a letter at that point as well. Other questions? Isabella.
I just had one more question. It's kind of a very basic question, but I'm just curious for everyone, what is maybe the most challenging thing about your role?
Basic question that's going to have a large range of answers. So who would like to start on that one? Or I'll pick somebody
I'll
else.
start.
Oh, go ahead, Fahad.
Oh, sorry. I know I touched on a skill or characteristic being like time management, but there's a lot of days where I feel like I don't have enough time in the day, or I run out of time. I don't get to everything that I wanted to. But realizing that it's okay to not get to everything, it's fine. Or if you feel like you've overstudied, stop. Because if you feel like you're rereading the same thing over and over, your brain's telling you that, it's done, it's had enough. Take the break, relax, and learning when to step back and take the breaks. It's okay to take multiple breaks. I try to implement the Pomodoro technique and study for 30 straight minutes and then take a 5 to 10 minute break, 30 minutes, 5 to 10 minute break, do them in intervals. It kind of keeps me on track, but maintaining the time management sometimes is pretty tricky for me because I sometimes run out of time in the day, with classes all day, and trying to get involved in clubs or TA sessions. They usually occur in the evening, around this time, 6, 7 o'clock. And then finding the time to, eat, take a shower, work out, maybe, talk to your friends, your family, spend time with people, go outside. Sometimes I feel like there's not enough time in the day. I know there is, but it's just tricky to, make sure to maneuver it correctly, I think. I think that's the most challenging for me.
Excellent. Thank you. Jean.
I think probably at this stage of my career and training, the most challenging piece is that I have to see, I work 7-hour days because again, and this is one of the huge benefits of being a mid-level provider. I get to work while my children are in school. So I work 3 days a week, 7 hours a day, but it is so jam-packed. I am back to back seeing patients. So I'd say the hectic nature of the schedule is probably the most challenging thing. And I don't get to pour into my patients in the way that I want to, which that goes back, Isabella, to your question on the business model. And what I'm learning is that there are opportunities out there and there are practice models that would allow me to address those challenges that I'm talking about. So I've identified that as the thing that's really the most frustrating is, and especially taking care of patients in a way where lifestyle is the primary focus. It takes more time than you've got belly pain. I'm trying to think of a appropriate example. I'll use my GYN. So you've got a yeast infection. Well, here's some fluconazole, right? Well, there's a whole bunch of other stuff that goes into that discussion of why is this happening? And you can't address that in a 15-minute visit. That's impossible. And so, you know, to look for opportunities to create a business model to practice in an arena where you have the opportunity to not see, well, two things: to not see 15 patients in a 7-hour time slot. And then also to be able to learn, to be able to grow your practice and your business in a way that's appropriate in 2021. Because I do think, I think there's lots of options for technology. I think there's lots of options to connect with patients outside of that one-on-one visit. And so there's lots of ways that are available. And so that's honestly like a area that I'm looking into now and trying to learn about, because I identified the fact that I don't like practicing medicine that way. And I want to figure out a way to fix it.
Thank you. And then, Bianca or Virginia, do you have a?
Sure. I think mine is more so barriers within the realm of healthcare in itself. And so, for instance, when I have an adolescent with mental health concerns, our internal referring mental health department is no longer seeing patients, like new patients right now. And so that's really frustrating to me because I'm like, this is our health system. How can we not support our own patients, you know? And so then, unfortunately, I work with a wonderful team where we got very creative and we made a resource area in our physician room, if you will, or office. And so we have all mental health resources on there that are like, whether they're locally through the health department, we even put on there some resources that are like external referrals that will still accept some of our patients' insurance type. So then that way that they don't have a large out-of-pocket cost. And just really connecting with the community, like the Julie Valentine Center for some of our patients with abuse and assault. And so just trying to get creative to learn about what is available out there, because things are, it's just sometimes we have to dig, and sometimes that just takes time away from patient care, or writing up your notes, or sending responses to patients back about their test results or lab results or questions. And so sometimes it does get tiring, but I feel that like it's my duty, and I care so much about my patients holistically that I don't want them to fall through the cracks mentally, or just even physically with any part of their care.
Excellent, thank you. And then Virginia, challenging aspect.
I don't have a whole lot to add. A couple of things that, I sort of say to some of the students that I precept in regards to, interaction with patients is sometimes the most challenging aspect is like, what is the patient expecting from the visit? And so, for example, a lot of times, somebody twists their ankle or, and it's like probably not broken, but it's like, any kind of ortho injury. It's like, are they expecting you to do an x-ray? Are they okay with just maybe waiting and seeing, and then, you'll hear people, that have, I went to urgent care with, they had cold symptoms, and it's like, well, they didn't do any tests, it's like they didn't get a good visit because they didn't have any tests done, which, or again, that can go a number of ways, cost of the visit, cost of insurance, sometimes I'm like, hey, there's some radiation exposure with a little tiny x-ray that may not be necessary. But I say, aside from, again, all these other external factors, sometimes the person that sets your schedule and schedules your patients for you, which a lot of our patients can schedule their own appointments now through their patient portal or my chart. And, so, it's like, shortness of breath and it's scheduled a week out. Well, that's not, not actually an appropriate, visit to be scheduled. Or, a lot of times, patients like, oh, well, I was due for, really, we do a lot of, I do a fair amount of pap smears even in family medicine. And they're like, well, I was wondering, do we have time for my physical today? Just like, well, you were just scheduled for, a med follow-up or something, or, belly pain. I think we need to address that first. So, that, having the appropriate sort of amount of time sort of scheduled. So.
I would agree with that. The patient expectations, what people expect of you and what is appropriate. And I don't know if you agree with this, Virginia, but I mean, since COVID, it's infinitely harder. Has been my experience.
So I should probably share with the audience. And Jean, you may not know, my sister is actually with you and Bianca, that my sister is a women's health nurse practitioner, and she's in Ohio, and she literally had a postmenopausal female sit cross-legged or arms crossed on the exam table and said she was not going to leave there until she was given metformin to help her with weight loss, which her body mass index was like, it's not even right. And I had somebody the other day, sort of the same thing. It was, we have had if a patient's 18 and up, we've had, unless they need assistance, still have a no visitor policy. And, 19-year-old college student comes in with cough, sinus infection. Mom's upset she can't come back. Comes back in the office demanding a prescription for cough syrup, or she's not leaving. People have kind of just and that's where I'm like, that's where the skin sort of, thickens. And I'm like, well, he was the patient. He did not ask for. So that, again, in that scenario is maybe the mom's expectation. But people have unrealistic expectations sometimes as well. So, sorry.
Excellent. No, this is great. Yeah. Well, we are closing in at 8:30. I'm going to turn it over to Rebecca, because I'm sure there are logistical things that I have forgotten.
No, you're good. Yeah, I just want to thank everybody for coming, and especially thank you to our panelists. We could go on for hours, I'm sure, with more and more of this. So we will follow up with everybody that attended with some resources, like how to get in touch with the folks who are here, how to get in touch with our offices if you want to explore further, and just how we can help you learn more about these professions or what might be a good fit for you. But other than that, we just appreciate you coming.
Yes, thanks again to all of our panelists. You guys are amazing, and thanks for putting up with my ridiculous rambling as well. But again, excited to see everybody, and thanks so much.